Hello my dear friends. We have a very exciting video today. I'm going to be doing my first at-home microneedling treatment with the Dr. Pen M8S. I'm so excited. I have been on a journey to healing my acne scarring at home on my own. I had a cystic acne in my teens and I have like boxcar and ice pick scarring. I have had about 10 or more microneedling sessions with an esthetician along with some peels as well, so I do feel very comfortable doing my own treatments at home because I kind of know how my skin's going to react and what to expect as far as like the healing process and everything like that. And so I'm so excited. I was actually the one to reach out to Dr. Pen. I'm so grateful they were welcoming to collaborating on this video together. So they did gift me the microneedling pen. This is the Dr. Pen M8S, like I was saying, and it comes with a little case if you'd like to use that. They also sent me the 18-pin cartridges and their hyaluronic acid serum. So I have everything here ready for my first treatment here at home. I am going to be using the 18-pin cartridges. They have a 12-pin and then they go up to higher amount of needles. So when you're treating the deep acne scars, the less needles is going to be is better because the needles are able to penetrate deeper than if you have more needles. The M8S actually has the capability of having the nano needles, and they do come with a pack of nano needles, and they're silicone topped needles, so they help your skincare penetrate deeper. But that is a different treatment than I'm going to be doing today. I plan on going pretty deep on my first microneedling session here at home. I feel comfortable doing that, and I have deep acne scarring. With my research, it is proven that you have to kind of go deeper to see results. And like I said, I have had over 10 microneedling sessions with my esthetician, and the deepest that she would go was 0.75. So I'm gonna go at least 1.0 because with that many sessions at 0.75, I still have quite a bit of acne scarring. So I'm gonna see if the deeper needle makes a difference. But definitely follow the recommendations. Start slow. If you're doing this at home and it's your very first microneedling session ever, definitely start slow. I started slow with my esthetician and worked my way up to 0.75. So definitely follow the guidelines on starting at the lowest depth and working your way up. So the first step, since I am going a little bit deeper, is going to be applying an over-the-counter numbing cream. This has 5% lidocaine. It's really highly rated on Amazon. My esthetician would recommend this one prior to my sessions with her, so this is the one I got again. Of course, I disinfected my whole working space. I have a clean towel set out on top of everything for my microneedling, and what I'm gonna do is wash my face, disinfect my face, apply the numbing cream, go ahead and disinfect the cartridge in this glass container, which I already disinfected with alcohol. And I'm gonna soak my cartridge in here and then wait for my numbing cream to set in, and then we'll do the session. I plan on doing the stamping method for my first one, especially since I'm going a little deeper. I don't want to risk any dragging. So I'll be applying the hyaluronic acid serum after the treatment. But if you're doing the traditional way of microneedling, you're going to do passes, and you're going to want to make sure that your skin is very hydrated with the hyaluronic acid serum as you're doing the passes on your skin. So I just did one pass of cleanser on my skin, and I'm going to do one more. So I'm going to use 70% rubbing alcohol and disinfect my face. Some people skip this step, but I think it's really important just to reduce the risk of infection, especially if you're microneedling at home. My skin does not react poorly to the alcohol, so it's fine. So now I'm gonna apply the numbing cream. I'm gonna apply it with the glove. Okay, I can already start to feel that numbing on my face. I'm gonna set a 20-minute timer. So now I'm going to fill my container with rubbing alcohol, enough to submerge the cartridge. This is what the cartridge looks like. On here it says sterile, but you still want to make sure to sterilize this yourself in rubbing alcohol. So I'm going to take the little cap off, and you can see the needles. You can see the cartridge is fully submerged. You want to make sure it is sitting in rubbing alcohol for minimum 5 minutes up to 10 minutes, and then you want to take it out and let it air dry. Okay, so I'm gonna let this numbing cream sit for the allotted time, and then I'll be back to do the session. I'm gonna take the cartridge out and now let this air dry. And the cartridges are one-time use only. Do not try to disinfect the cartridge and reuse it. You use one cartridge one time. If you want to get the most bang for your buck, you could do your face, neck, hands, chest, or something if you want to use the cartridge to its full ability, but do not reuse a cartridge at a different session. Okay, my numbing cream timer is off, so I'm going to wash this off with face cleanser again, disinfect again with alcohol, and then do the pimple patches. I'm going to do one more pass with the alcohol just to really make sure there's no lidocaine on my face. My cartridge is done drying, so I'm going to put it into my pen. So that is the needles moving. I'm going to wear gloves. It's not necessary, but I'm just being extra cautious. I'm going to start on my cheeks. I'm getting nervous because I don't want this to hurt, but I guess I can always go lower if I need to. Okay, I'm going to start lower and then work my way up because I'm scared. I'm going to do 1.0 on my temples. So at the time of recording this voiceover, it's been over a week since I did my first microneedling treatment, and let me just tell you, I learned so much from this first session. You will have to stay tuned for the next video. I will be doing the recommended cross-hatch method from Dr. Penn. I was able to talk with Dr. Penn, and they do not recommend the stamping method at all. They are very consistent with recommending the cross-hatch method. I knew this going in. It is the method that dermatologists and professionals use. However, since it was my first time using the pen, like I was saying in the video, I just did not feel comfortable doing any sort of dragging motion. But after I did this first session and got a feel for I'm going up to 1.5 on my cheeks, how the pen worked, I definitely feel comfortable to do the crosshatch method for my next session. So please consider subscribing so you don't miss my next microneedling video. I will be showing you the proper technique for the Dr. Penn. I did speak with them further, and they said that the stamping method can lead to inconsistent results in the long run. So it's best to use the crosshatch method so you can have consistent, even results. And this is why I love sharing my experiences online. That way you can watch this and learn from my mistakes, start at a different pace, and do the proper technique. Now that it's been over a week and my skin has healed, I can tell that it was definitely a more mild treatment with the stamping method, even though I did go at a deeper length. So alternatively, if you're starting off with the Dr. Penn, I would recommend starting at the lower depth, especially if it's your first ever microneedling session, and doing the crosshatch method, and you're going to get a much better result. Even after this first stamping method, I could see what they mean by stamping can lead to uneven, inconsistent results. So I'm really looking forward to my next session. And the last couple things I want to address is the first thing being I went at a deeper length on the areas that I have the deep acne scars because, like I said, I have already had over 10 treatments in a professional setting and I have not seen any results with the acne scarring. So I thought I would try at a deeper length at home, and I know my skin is used to the microneedling. So if it's your first ever microneedling session, definitely do not start as deep as I did. The next thing that I think I edited out of the video is that if you see little areas that I missed intentionally where I have a pimple patch, is because I put a pimple patch over the pimples so I would not accidentally go over them and spread bacteria. So I'm going to go down to 7.75 for my forehead and my chin. So now for the nose and eyes, I'm going to go down to 0.25. That completes my first at-home microneedling session. I'm of course very red. You can see where I did the stamping. I think once I get more comfortable with the pen, I can try the, like when they do like circles or lines up and down, to do the microneedling with the hyaluronic acid on the face. For my first session, I just felt more comfortable doing the stamping method because it felt more safe. And I'm really excited to see how my skin heals from this, how it reacts, and hopefully I can see some improvement, some real improvement in my acne scars here on my cheeks and in my temples. I am so excited. Now that I'm done with this, I'm gonna take off my cartridge and we're gonna dispose of it because we're not gonna use it again. This is gonna get disposed of along with, you know, all the trash. Like, we're not gonna reuse this. So I'm gonna put the cap back on here and it's gonna go in the trash. I'm gonna store my pen back in its little case, charge it up for my next session, which will be in about 4 to 5 weeks, depending on how my skin is healing. And then now I just am going to apply the hyaluronic acid serum to my skin. I'm gonna apply gloves again just because I created all these micro traumas on top of my skin. I have all these little needle holes, you know, in my skin. You want to make sure everything is very sterile. You don't want to put anything on your face. You want to put absolutely no actives on your face. I would really only stick to hyaluronic acid. You want to make sure the dropper doesn't touch anything either. And then you don't want to sweat or, you know, work out or do anything like that for 24 hours. And you also don't want to wash your face for 24 hours. You don't want to take a shower for the next 24 hours. You really want to give your face time to heal. Now, I did go pretty deep for my treatment, so I'm curious to see how my skin is going to look, you know, tomorrow. So I'm going to do a few days of a check-in to see when my skin kind of looks back to normal, so you guys can get an idea. I'm going to apply a little bit more serum just because that felt really good on there, just to really hydrate. That really completes my first microneedling session. I will check in tomorrow morning, maybe in the afternoon, and give you guys updates on how my skin is healing. And then of course I will I will be recording my next microneedling session as well. So if you have any questions, let me know in the comments so I can reply to it in the next video. It is the morning after. Yes, I went to sleep in the same shirt. My skin is a lot less red than I was expecting it to be. I'm really happy with the results. It seems like my skin is healing really well and taking to the deeper microneedling well as well. So here's a little close-up. You can kind of see all the little micro traumas. Definitely have some swelling. Overall, I think my skin is reacting really well to the microneedling. I don't have any workouts planned today. I'm going to take it pretty easy. I am about to go outside with my son though, so I'm going to be putting some sunscreen on and wearing a hat just to really make sure I'm protecting my skin. If you're considering doing microneedling at home, I would definitely recommend the Dr. Pen microneedling pen. They have so many options available. I was about to buy this pen myself, but I decided to reach out to the company. Thank you, buddy. I decided to reach out to them to see if they would collaborate with me because I do a lot of skincare videos here on the channel, and I'm so grateful that they agreed to that. Regardless of the pen being gifted to me, I had already vetted the company out and I was going to purchase it myself. Like, I really think it's the best microneedling device that you can get at home. I'm really excited to do my microneedling series and see if I can finally heal this leftover scarring on my face. I can't even imagine what that will be like, so I hope that it's effective. I do have a discount code with Dr. Pen, so I will have that down in the description, and I will list the pen that I have and the cartridges and everything that I'm using. That will all be down in the description for your convenience. I'm so excited to be starting this microneedling series here at home, and I will see you guys in my next video.